I think we don't really have a whole lot of boundaries as a society. You have to go swim upstream in order to put some boundaries in. All of that distraction, I think, takes us out of our body, out of those feelings of really understanding, like, oh, what is this feeling? I always tell people, it's your body sending you a signal. Your body is sending you a signal saying, hey, I need something. And it's your job to go and find out what it needs and give it to your body.
Welcome to Power Up Recovery with Nutrition. It is time to make nutrition part of the conversation. I'm your host, Christina Veselak, and I'm so glad you're here. Did you know that it's our brain's job to allow us to cope with stress gracefully? But to do that, it needs to be fed optimally. Have you ever wondered why so many committed people relapse or maybe even die? Why so many people on psychotropic medication still feel lousy and still have cravings? What if the missing piece is food, the right food? What if the right nutrients like amino acids or even eating protein every 4 hours could actually balance your brain chemistry and your mood without medication and support lasting recovery? In this podcast, we explore the powerful connection between feeding your brain well, mental health, relapse, and recovery from addiction. We will share insights from experts, inspiring recovery stories, and practical strategies you can use today. Whether you're in recovery, a healthcare professional, or someone passionate about emotional well being, this show is for you. Let's dive in and discover how fueling your body and brain with the right food, the right amino acids, and other key nutrients can fuel your transformation today. Welcome. Hi, everyone. Welcome back to the next episode of Power Up Recovery with Nutrition, where we speak with clinicians, where we speak with researchers, where we speak with people who share their own recovery stories about the power of nutrition in both mental health, but especially addiction recovery. And so today I am delighted to welcome Dr. Brooke Scheller, who's really a woman after my own heart. And she and I have a passion for the same approach. Dr. Brooke Scheller, Doctor of Clinical Nutrition, Certified Nutrition Specialist, and Certified Functional Psychiatry Provider, is a leading voice helping people transform their mental well-being and recovery journey using the power of food. Dr. Scheller has dedicated her extensive clinical expertise to a single mission: showing others how nutrition and functional medicine can be the foundation for an alcohol-free, vibrant life. She understands that true wellness means optimizing the brain and body to thrive, not just treating symptoms. I agree. With a passion for bringing cutting-edge science into clinical practice, Dr. Scheller has dedicated years to collaborating with and building specialized nutrition programs for mental health and recovery centers across the country. Her work is focused on creating practical, science-based strategies for the often overlooked components of sustainable recovery and mental wellness that support mood, improve energy, enhance gut health, and balance hormones. She is the founder of the Scheller Collective and creator of the globally recognized functional sobriety approach, which has empowered thousands to reclaim their health. This methodology goes beyond traditional recovery, using personalized nutrition and supplements to profoundly improve brain health, stabilize mood, and restore vitality. Dr. Scheller is also the acclaimed author of How to Eat to Change How You Drink, a sought-after speaker, content creator, and strategic brand collaborator. She makes functional nutrition accessible to everyone seeking a better way to live.
Thank you so
Thank you
much,
for being here.
Christina. Yeah, I'm happy to be here. I'm very glad that we found each other, and it sounds like we've been on the same trail for quite some time.
Right, very, very parallel journeys.
Hmm.
So I would like to start our conversation by asking what makes you so passionate? I know what makes me so passionate about bringing nutrition into addiction treatment and recovery, but what makes you passionate about it?
That's such a great question. And I think partially that is from my own experience in sobriety and quitting alcohol after I had done all of my studies in nutrition. But part of what influenced me going into the field of nutrition was I was really interested in nutrients and how they worked. And I was really interested specifically in mental health and addiction because this was something that was in my family. And prior to my own experiences with going into recovery and quitting drinking alcohol, um, I saw a lot of addiction and mental health challenges around me in my family life, with friends, etc. And what's interesting is I did my undergrad in nutrition, I got a master's, and I got a doctorate. And part of that was because I loved what I had learned in the beginning, but I needed to know more about the why. It didn't really sit well for me, like, well, you take vitamin C and it's good for your immune system. I wanted to know why, right? Why? And I
I'm always asking the upper level questions, and people look at me blankly instead of don't know the answer.
Totally, totally. Because when I first started working in nutrition, my first career job was in weight loss. And we created these tailored weight loss plans for folks, and they would lose weight, but they would still be struggling with their mood. They'd still be struggling with their hormones or their digestion. And I knew that food could do more, but I didn't know how. And so I really sought out more of that education to be able to help people more and what they were experiencing, to use food to support whatever was ailing them. But really, when I went through my own recovery journey, I had not seen people like you quite yet. And I started looking around the recovery space, and I felt like, no, this conversation wasn't being had enough about nutrition and the influence on recovery.
And
And
it's still not.
it's still not. We're working hard. It's going to take a village, I think, a little bit to
Mhm.
broaden this conversation. And I don't know about you, Christina. I'm always in the camp of the biochemistry of addiction and mental health concerns is at least 50% of the puzzle.
It
We
is.
often
It
address it
is.
through mental health and therapy and all of these different amazing tools. But if we don't address the physiology, we don't address the biochemical challenges,
That's right.
we're missing a big piece of it.
Well, we are, and they've always said I've been in the addiction field now for 40 years. And 40 years ago, they were basically saying the same thing. Addiction is a biochemical disorder, well, is a biopsychosocial and spiritual disorder. And here's the medication that we use to take care of the biochemical side of things. And now let's talk about prayer and 12-step meetings. And finally, they started talking about trauma. When I first got into it, you know, they weren't talking about trauma, but finally they are now. And I should say we are now. But, so I talk about the three legs of the stool. But the problem is that you can't do therapy and you can't even have an effective spiritual life if your brain is out of balance. And everything throws our brain out of balance. Our hormones, I mean, you name it, it can throw the brain out of balance. And then we're not able to utilize the other psychotherapeutic or spiritual tools. And that's why I'm passionate about this.
Yeah, I love that. And I think it's really an amazing space. There's a lot of opportunity for more research, for more
Mhm.
stories to be told, for more podcasts like yours to help educate people, because I really do believe that if I had understood more about the physiology of alcohol and how it influenced my body, maybe I would
Mhm.
be more likely to think, oh, is this causing more of my problems than I think it is? And even as someone who is an expert in the field, it took me getting to the end of my rope, if you will, before I was really able to see that. And so my passion really comes from just wanting other people to see that too. And especially in the world that we live in today and people being so interested in health and wellness and nutrition, that this can be a really great way into the conversation that maybe hasn't stuck for other people or for certain people.
Well, I think so. And people are much more willing to talk to a nutritionist than they are to talk to a therapist or an addiction counselor.
Right.
We fly under the stigma radar.
Mm-hmm. Mm-hmm. Yeah, because I think that from my experience in working with clients, some come to me knowing that they want to quit alcohol or that they really are at a point where it is having negative effects on their life. But there are other people who are just really exploring it. And when we talk about their gut and how they have IBS, for example, and we can put the pieces together of the puzzle of why the alcohol might be influencing the IBS,
Right.
they take a break, they see those symptoms resolve, and then now there's something to attach to it. Now there's something more tangible for them versus just feeling like they have to identify with having an addiction.
Exactly.
Mm-hmm.
And now just the concept of addiction itself is within a bigger context. It is more a symptom of what's wrong than the thing that's wrong. Let's fix addiction and everything else will magically repair itself. Yeah, well, not quite so much.
Yeah. Yeah. It's a symptom of something out of balance in the body and brain. And it's still mind blowing to me, Christina, that we have people going to their primary care doctors year after year, and we still don't have standardized nutrient analysis for people. They have to seek it out, or they have to, claw their doctor to try to get them to run certain lab tests. I mean, vitamin D is kind of becoming a little bit more commonly tested. Finally. But I'd love to see B vitamin panels and I'd love to see mineral panels. And all of those things are so important and such a foundation of not just our brain, but how our entire body works. So it's really this overlooked piece of the puzzle in so many elements.
It really is. I just put together a mini certification program for the American Psychological Association on psychology or mental health and nutrition. It is very fun, very exciting. But the very first module was on why it even matters to mental health to talk about nutrients.
Yeah.
And so I started talking about the brain as a physical organ. It weighs 3 pounds, but it takes up most of the energy in the body. And it's a thing, it's a physical structure, right? It takes up space, but that means that it is literally built out of the food we eat.
Mm-hmm.
We have to eat what makes our brain.
Mm-hmm.
And then we have to eat what makes our brain run, right? So first you have to build the factory, and then you have to bring in all the raw material for the factory to do its job. Right?
Love that explanation.
And so we have to first eat the nutrients to build the physical factory in the brain and the insides of it, which are really quite elaborate and amazing and astonishing. And then we have to bring in the right nutrients so that it can do its job.
Yeah. Yeah, and I think that leads to even talking about the amino acid therapies and supporting dopamine and serotonin and GABA pathways and everything along those lines. For example, I think dopamine is a very hot topic. I think if you ask most people, they'd say, oh, they think they know something about it. But I'd say 99.9% don't know that nutrition has anything to do with dopamine, that we need these certain nutrients and amino acids as the foundation in order to actually produce the dopamine. It's not just a magical, a magical, wonderful little thing that gives us a hit of energy. No, we need to actually produce it and we need nutrients in order to do that.
We do. We need the amino acids from the protein we eat, and then we need the cofactors from the fruits and vegetables and everything else we eat. And the carnivores say you can get it all from meat, and so I'm not going to argue with that. But anyway, we need to get it from
Hmm.
somewhere,
Hmm.
right?
Yeah.
But what a lot of people don't think about, although, Chris Palmer and some of the metabolic psychiatrists are beginning to unwrap it, is that we have to make the neurotransmitters, but then we have to fire them. And what
Hmm.
does that mean? That requires effective cell membranes with all the right fats, the cholesterol and the omega-3s and the omega-6s and the plasmalogens and, right?
Hmm.
But we also need all the nutrients for a very robust electrical system.
Hmm.
Because when the electrical system fails, and this is what Dr. Walsh is discovering and Dr. Bob Miller is discovering genetically, when we have genetic SNPs that impact the electrical system, then the amino acids or the neurotransmitters can't even do what they're designed to do.
Hmm. Yeah. And what I find to be particularly fascinating about the amino acids and proteins is how often, especially in folks who use alcohol or substances, the deficiency in digestive enzymes or
Mhm.
stomach acid levels, and how
That's
really
right.
we're not breaking down our food. And so we're not even getting those amino acids. I run a lot of organic acid testing with clients, and we'll see amino acid panels basically looks like they're completely deficient in every amino acid, which in that case tells me, is it the electrical system, or is it certain parts of the body that are influencing this, including the stomach and our digestive system?
Right. So we use an assessment tool called the amino acid therapy chart, designed by
Mm-hmm.
Julia Ross. And it asks just
Mm-hmm.
deficiency questions through all four neurotransmitter categories. And,
Mm-hmm.
a lot of my students have clients who just score nines and tens with symptoms across the board. And they say, well, what amino acid should I start with? And I say, you don't.
Mm-hmm.
Because when people are depleted across the board, it either means that they're not eating enough protein or they're not digesting and absorbing it.
Right.
So you start with making sure they got the protein in place, and then you make sure they're digesting and absorbing it. And once we've done that, then we will redo the amino acid therapy chart because it only takes a couple weeks to actually get things in line and working better. Then we'll redo it and see what's left out. And then you may want to bring in an individual amino acid or two.
Mhm. Yeah, it's fascinating because again, we live in this world where many people think that they have digestive symptoms, that they have too much acid, or they have, overproduction, or they need to go on a certain diet. And it really is fascinating to me. Again, I do a lot of lab testing. I find that lab
Mhm.
testing is so helpful, not only for me and understanding how to specifically support a person, but also for the person themselves to understand what's going on in their own body.
That's right. And to
So
see it in black and white.
yeah, to see, oh, I have low digestive enzymes. That influences my ability to digest and absorb those nutrients. That's going to make me more likely to take that supplement before I eat my meal because I know what it's actually doing for my body.
That's right.
And it's really important, I think, for people to understand that, especially in the recovery setting and in the mental health setting. I think it really helps us get back in touch and in tune with our bodies too.
Well, I love the word empowerment.
Mm.
I want to empower my clients to take care of themselves, take care of their brains, take care of their mental health, themselves
Mm.
for the rest of their lives, way long after they've forgotten my name and what I look like, right? And so helping people understand these processes, and there are a few people who just don't want to, and okay, that's fine. But most people are really excited to understand because they feel empowered,
Yeah. Yeah.
because it's
It
not just
it
about
makes
going to an expert.
Yeah, it makes it more clear to them, I think, again, in not only understanding it, but feeling like they can take action on it, that they can continue with it.
Mhm.
Again, it's the same. I'll use that same reference of take vitamin C for your immune system. Great. Okay. You could take it. You don't really know what it's doing. But if I know that my body has deficiencies in these certain things, and that
Mhm.
this is the way that my body needs to eat, or these are certain foods that make me feel my best, then it's going to make it a heck of a lot easier for me to stick to that because I have more clarity on why that is.
Exactly. Exactly.
Mhm.
So it includes compliance. I mean, what a word. But,
Mhm.
so many of my clients and myself too struggle with taking what I need to take it and take it regularly, and my clients do. And, so many of my students keep saying, how do you actually get your clients to do what you want them to do, to change how they eat, to take the
Mhm.
supplements, to? And it's like, well, it's sort of this dance. It's this
It's
dance.
danced.
But what really matters is to get positive results really quickly.
Mhm.
And what's wonderful about the nutrient approach is that we get results really quickly and really robustly. And that helps build trust, that helps build motivation. And now we need to be cheerleaders and we need to be reminders and we need to help people notice that they feel better. And when they don't take their supplements or if they skip 3 meals, how they feel.
Mm. That is
Yes,
one
the
of the
reason why you had a craving is actually because you forgot your snack.
That is one of the biggest things I think that was eye opening to me in my own recovery journey when I started learning more about blood sugar and the influence even that alcohol can have long term on your blood sugar hormones. And I I think it is so overlooked the way that people drink to cope with afternoon stress.
Mm-mm.
And what do? We often, well, we eat lunch, maybe we eat something that has protein or we don't. We're busy in the
Often
afternoon,
don't.
we grab a handful of candy or chips. And then we get home from work, we haven't eaten in 6 hours and we're stressed. And of course, what do we want to do? We want to drink. Where simply just looking at having lunch with more protein, having that afternoon snack. And I always suggest to people don't skimp out on the afternoon snack. Make it something substantial. It's not just a handful of nuts. Make it something that feels like it's satiating you and filling you up a little bit because that's really going to take away that craving later on. And
It
it's
is. And it's going
fascinating
to carry
how
you through to dinner.
quickly that helps people and how it's still very hard to see even when it's right in front of you. Mhm.
Well, it is. And I mean, I'll have people, my favorite question that I've now been asking for 25 years is when was the last time you ate protein prior to your craving, your slip, your domestic violence incident, your panic attack, your whatever, right?
Mhm.
And this is where I kind of came up with, my rule of thumb, which is that 20 grams of protein every 4 hours. Um, but what I have found is that people don't connect how they eat, what they eat to how they feel. They need to be taught how to. And by the way, we can start teaching our 5-year-olds this. 5 is the age that we can start teaching our kids,
I love
to
that.
connect those dots, and that's prevention. Um,
Hmm.
but I'll still have so many clients who really try really hard to follow that regimen because it works for them. But then they'll say, I just had this really strong craving or I had a slip. And I ask, well, when actually was the last time you ate protein prior? And they'll think back and because they'll be saying, yeah, I'm doing a really good job with my eating. Well, when actually? And they'll think, oh, I just grabbed a banana for breakfast
Hmm.
and I kind of sort of didn't have lunch that day. It's like, yeah. Hmm. Hmm.
Yeah.
Cravings don't actually come out of the blue. There's a very real biochemical reason for them. Biochemical reason, and we're one of the very few addiction specialists in the world who see triggers as biochemical rather than as stressors or upsetting events or. Well,
Hmm.
what's your relapse trigger? Well, missing a meal was my relapse trigger
Yeah.
because it means that I can't step up and deal with whatever the stressor is.
Yeah. And I really do think that we aren't taught how to see it. We aren't taught how to, I think the best example that I usually give clients of low blood sugar and having a craving is that dang Snickers bar commercial. That
Right.
hungry, why
They
wait?
got it,
Okay.
didn't they?
But no, you don't need to eat a Snickers bar. But this is a really good kind of pop culture example of being hangry because
Right,
we all get there. We all get to that
right.
point. And it's not always the first thought to go, you know what, my blood sugar's low, or I need something to eat. The first thought for some people, for me for a long time, was I need something to drink because I feel out of, out of whack. I feel a little off balance.
Little off
And
balance, right. So I need a drink, or I need a smoke,
mhm,
or I need a vape with that little bit of THC in it,
mhm, mhm,
right? Rather than eating.
mhm. Yeah, and I think a lot of where I'm looking at now too is we're just so bombarded by stuff these days. There's a lot going on. Our brains are being so overloaded with the amount of media that we see, the notifications, the emails, the constant stress. I think we don't really have a whole lot of boundaries as a society. It's you have to go swim upstream in order to put some boundaries in. And all of that distraction, I think, takes us out of our body, out of those feelings of really understanding, like, oh, what is this feeling? Like you said, Christina, a trigger or a craving. I always tell people it's your body sending you a signal. Your body is sending you a signal saying, hey, I need something. And it's your job to go and find out what it needs and give it to your body.
That's right. That's right.
Mm-hmm.
And we have lots and lots of tools. Psychiatrists have very small, tiny little toolboxes. We have a huge toolbox. So I'm going to ask you an unfair question. Okay. And the unfair question is, what's your favorite nutrient?
Oh my gosh, I knew you were going to ask me this. For some reason, I knew that was because only people like you and I have favorite nutrients. um,
And it's unfair because there's a million wonderful, necessary, crucial nutrients out there. But what's your favorite?
oh my gosh. I'd have to say I love B12. I love B6. I love zinc. I
Yes,
love, I mean, those are
yes.
probably my favorites. I think they're kind of underdogs in a lot of the sense, even the commonality of the B12 deficiency and how easily that's overlooked in something like mental health concerns or
Mhm.
addiction recovery. And I think that, really understanding that these nutrients again support every system in our body. You know this, Christina. I'm
Right.
saying it more for your listeners that this runs everything from our energy to our mood to our muscles to our eyes to our ears to
For our
every
bowel movements.
everything, our bowel movements, right? And so, it's wild to think that we aren't thinking of them more at the top of the list, which is where I think people like you and I put them. What's your favorite nutrient?
Well, I want to talk about zinc and B6. My favorite
Okay.
nutrient are the omega-3 fatty acids.
Yeah, they're high up there on my list too.
Yeah, yeah. But I'll talk about why in a minute. But zinc and B6 are pretty
Mhm,
high up there for me because, of course, we need
mhm,
them to make our serotonin. We need them
Mm-hmm.
to make our GABA. We need them
Mm-hmm.
to make our digestive enzyme, well, our hydrochloric acid. We
Mm-hmm.
need zinc to do a amazing multitude of things. Everybody knows that, or some people know, I think it's B6 is involved in 300 enzymatic processes, but I think zinc probably outreaches that.
I think you're right. And I think they're very overlooked. Again,
Sure.
we're not looking at lab values. We're not saying, hey, is this person getting enough zinc? I see a lot of zinc deficiencies in vegetarians and people not getting a lot of protein. And
And
yeah,
teenage boys, think
yeah,
about the poor teenage boy whose all their available zinc is going to build their prostate and make more testosterone.
yeah,
And there's
yeah.
not enough left over to make anything else, whether it be thyroid or your serotonin or your GABA.
Mhm.
And then they start having emotional behavioral issues, and everybody says, oh, it's just their hormones. Well, maybe not.
Maybe it's the zinc.
Maybe it's the zinc that's being used
Yeah.
to make their hormones.
Hmm. Yeah. And again, we classify these things as quote unquote normal in a lot of senses, right? Oh, it's a hormonal teenager, or oh,
Yeah,
it's a menopausal woman. Oh, it's, the angry boss,
right.
whatever it is. And we normalize so much of this. And it's fascinating. I actually had a blood draw today earlier at
Mm,
a blood lab. And the woman was telling me about how she, as a phlebotomist, she's always looking at people's veins. She's always
mhm.
looking like, oh, that person has should be with someone next to someone at the grocery store and she'll be checking out their veins and thinking, oh, they have good veins, right? And I know that that's true for me and maybe for you too, Christina, where I'll be looking, oh, they've got Frank sign on their ear. Oh, they've got, oh, pale
Right.
tongue, and I'm looking at
Or
these
they have
different,
little white spots on their fingernails.
and I'm thinking, oh my gosh, I want to go up to them and tell them, like, you should get your levels tested because I'm worried about you. So there's so many ways that I think
Hmm.
I love that we're the same kind of nerdy over it.
Hmm.
Hmm.
That's kind of fun. It's kind of fun.
So fun.
So I think one of the reasons fish oil is one of my most favorite, followed very quickly with borage oil, is because way, way, way back in the day, I had 11 different underlying biochemical drivers for my depression and anxiety, 11 of them. And so I had to discover it, layer by layer by layer, and it took me a
Mhm.
while. But I
Sure.
had a couple of major game changers. Okay,
Hmm.
tyrosine was a major game changer.
Hmm.
As it turned out, my dopamine was really low. And
Hmm.
fish oil was even more of a game changer. Now, of course, the symptoms of low omega-3s and low dopamine are very, very similar. And I had
Hmm.
the slow, sluggish depression. I had the ADHD, the problems focusing. I just boom, boom, boom. I had it all. And when I first took the tyrosine and then added the fish oil to it, the sun came out. The sun came out.
Mm.
Everything got brighter really quickly.
Mm.
My cognition got brighter, my mood got brighter, my energy got brighter. And it sort of changed the trajectory of my whole entire life and
Mm.
my mental health recovery journey.
I share a similar experience with omega-3 that it also really helped my own mental health journey. And I've seen it, again, I think where some of these topics get challenging is we've all heard omega-3 now. It's in the media, it's this, that. And people might take it for maybe they take it for a few days or here and there,
Right.
and you don't really notice the difference. And it's not enough
Right. Because you
to,
actually have to take enough.
you have to take enough, which is one of the problems. You've also got to take it for a couple of months, I think, before I really saw a significant difference. And some
Yeah.
that might range. You may have experienced it
See, I
sooner.
saw it within 3 days, but it
Wow.
does, it still has to coat every cell of your body. But so you do have to
Mhm.
take it for a while, for the tissues to fully uptake it. Absolutely.
Yeah. Well, and I think it takes time to realize that that's the piece of the puzzle that's changing it, right? Like in a couple of days, it could be the omega-3, but you could just be having a good day. So you might not even
Right.
recognize, oh, it was the omega-3, right? So I think it
Right.
takes time to kind of connect the dots that those, oh wow, I've had a
Mhm.
much better month now that I've been taking this omega-3. I'm having more consistency in my mood and feeling happier, less
Right.
days of depression.
And having less cravings. Have
Mhm.
you been? I interviewed Dr. John Umhau a couple months ago, and he was a senior.
Mhm.
He's retired now. Well, he's not retired as an addiction doctor, but he's retired from NIH. He was a
Mhm.
senior researcher for them, and one of his focuses was the omega-3 fatty acids and alcohol use disorder. And he
Mhm.
has lots of stories and research around how high dose omega-3s, so like your 10 grams a day, of
Mhm.
your straight omega-3s can significantly reduce alcohol cravings and relapse.
Mm. I've read a few of those studies, and I will often use omega-3 as part of a cravings protocol that I will do with people as well,
Mhm.
because I do find that, it does stabilize the mood, it stabilizes the cravings. I think it's a really good catch-all. I love that it's your favorite because I
Kind of
was
is, yeah.
almost one of the ones that I pulled out as being one of my favorites.
Well, catch-all is a really good word. I love it because it does so many different things in the body and therefore improves things in so many different domains. But the three you chose, the zinc, the B6, and the third one, I can't remember,
B12.
B12, that's right, also are
Hmm.
catch-alls. They do
Yeah.
so many different things in the body that when you get them on board, so many disparate things start getting better. And it's like, well, you mean zinc does all of this? It's like, yeah,
Mm.
it sure does.
Sure does. Yeah. It's fascinating. And I love these conversations because I think it's, again, really important for everyone to know zinc isn't just for if you're getting the flu and you want to take, something to
Right,
boost your immune system, that these are nutrients that we need, and we need them not just for our immune system. I
right,
think that sometimes these get hooked to certain things that aren't as sexy, like for example, omega-3s and heart disease. It's
right.
kind of like,
Yeah,
okay, everything's a heart disease and, more about heart
right.
disease. But
But not
omega-3s
postpartum depression
and the brain and depression and anxiety and ADHD,
and violence. I love those
violence.
studies they're doing now with violence and
Mm,
omega-3s because I used to
mm,
be a domestic violence counselor.
wow.
And while most of the time it was low blood sugar,
I was going to say,
and
I'd love to check the blood sugar right before, a violent streak would break
oh, I
out.
have some wonderful stories about that. But
Oh,
anyway,
you'll have to share with me.
yeah, yeah. Anyway, go on.
Yeah, I think it's fun to attach these things to other not so sterile or clinical associations because, oh, omega-3 heart, again, some
Mhm.
of these things that just feel kind of zinc for your immune system. Oh, great. Yeah, my immune system. We don't really care about our immune system if we're not sick, but most of us care about our brain and our dopamine and our digestion, right?
We sure do. And whether or not we can sleep at night,
Totally.
right? Because if you don't have enough zinc, you're not sleeping well at night because you don't have enough GABA, serotonin, or melatonin,
Yep.
right? And yet, you're right. Very few people make that catch
Hmm.
or look for it,
Yeah.
and then you have to prove to the insurance companies and come up with a diagnostic code to validate why you want a blood draw of zinc and copper.
Mhm. Yeah. And what I find to be really interesting, and I have used a lot of functional lab testing, so like a SpectraCell micronutrient test where you'll look at all the micronutrients across the board. But I would say 95% of tests have at least one nutrient out of range, at least. And so I kind of venture to guess that we all have at least something that we're deficient in or we could optimize.
That's right.
And so it's important because most of us are walking around not feeling well and we're looking for the solution. And again, the way that we're being bombarded by, no, this is the solution. No, this is the solution. No, this, you need this sweater. No, you need this supplement. No, you need this job. No, you need this vacation. We're
Right.
looking in the wrong places.
We are. And again, it's not just a spot check. We need this nutrient or that nutrient. We
Hmm.
need to be nourishing our entire system through,
Hmm.
a multitude of foods and nutrients, and
Hmm.
then lifestyle, and then healing of emotional trauma, and then, right? I don't just believe in a one-legged stool most of the time, though sometimes it is. But I do want to look at all three stools, all three legs. There we go. Um, so testing, can you talk about some of your most useful functional tests?
Yes. So that's a great question. And it's somewhat dependent on the person because it depends on what their symptoms are, what they're experiencing. I do like to run labs and, kind of get standard blood work and things like that. But usually I'll add on additional information like some more of the nutrients that are okay to look at in blood. Of course, as you know, Christina, serum lab tests aren't always the best way to look at nutrient levels. So
Right.
organic acid tests can be
Hmm.
helpful, or something like the SpectraCell micronutrient test. I probably across the board, I would say my most used test that I give to almost all of my clients would be a stool test. I
Mm-hmm.
I'm very nerdy. I love looking at the results of stool tests. I think it's fascinating. And
It
I
is kind of
think,
what shows up. Yes.
oh yeah, it's great. I mean, I have some clients who, have IBS, and sometimes that looks like in a stool test bacterial overgrowth or candida overgrowth. Sometimes it looks like low stomach enzymes. And, it's just very helpful to see what is the fix? What is, in the traditional medical system, it's you have this symptom, here is this medication. But oftentimes, especially in cases like that, in IBS, we're not looking at what is actually going on to solve
Right.
it. So I think it's fascinating because, especially with nutrition and the digestive system being such an important part of our nutritional status,
That's
that
right.
that one I really love doing.
What's your favorite stool test?
I like a GI map.
Hmm.
I've gone through different ones at different points, but I find myself mostly ordering a GI map these days and
Okay.
feeling like I
Because it's
trust
more
the.
comprehensive.
It's comprehensive. It's also a PCR test, so it's looking at the DNA. So
Hmm.
they claim that it's potentially more accurate for the certain bacteria or strains that you're seeing in there because they're actually looking at the DNA itself.
Nice.
Hmm.
Nice.
Not always a fun test for people to do. Sometimes they don't want to take this test. I always have to remind them it'll get shipped to you. You do it in the privacy of your own home. I don't do
And you can
anything with it.
and you can always wash your hands afterwards.
Always. But it's a good exercise for people because, again, I think we're very disconnected from our bodies. We should be
Mhm.
knowing what's going on in our bowel movements. If we're not looking, or not that you have to get real close in there, but you should know the texture, the consistency,
Mhm.
and the dynamics of your bowel movements because it
For
tells
sure.
us a lot about our overall health.
It really does. I mean,
Mhm.
the homework for my students I kind of half of them are functional nutritionists or health coaches or nurses, they're very used to these things. But the other half are the addiction counselors and the psychotherapists. And so in the very first module of my level 2 training is digestion. And so
Mhm.
the homework assignment for the psychotherapists is to ask at least 5 of your psychotherapy clients about their bowel movements this week.
Even that practice is good to get people going because therapists will talk about anything, but people are uncomfortable when it comes to talking about poop. That's one of my favorite things to try to challenge people on.
They really are. And they say,
Yeah.
I can't ask my client about that. And I say,
Mhm.
well, you talk to them about their orgasms. If
Exactly.
you talk to them about their orgasms, you can talk to them about their poop. I promise.
Yes. I love challenging people on that. I had an old boss many years ago, the CEO of a company that I worked for, and every time I saw him I used to be like, how was your poop today, Mike?" And he would get all red and flushed and awkward, and it was just like my favorite thing to kind of challenge people to be like, "Hey, we all do it. We're all doing it. It's
That's cute.
powerful to have conversations on it." And
It
it was
sure
a
is.
health company, so it was tied into the product. So I was
Okay.
trying to help him, get more
Oh,
comfortable with the product.
that's funny. Well, before we stop, I'd like you to tell our listeners about your book.
Yeah, so my book was published in December of 2023, but
It's right behind you.
it's right behind me. It was honestly not something I expected because I had the idea to write the book when I was about 3 months into my sobriety. The idea kind of hit me like a ton of bricks. And
Mhm.
I ended up going through and getting a book deal and having all this kind of move in this direction, which was really special. And I think really told me a few things. One, that, this sobriety was like part of my path, that I was meant to kind of get here and be able to teach this information, be able to help others. I don't recommend writing a book about sobriety when you're early on in your sobriety, but I really took it from the context of my expertise and nutrition
Sure.
that I had been studying for so long. And, um, it's been really a game changer and I've gotten so much positive feedback on it. And it's really intended to help people start to connect these dots and take some of these actions, even if it's just a few simple ones that can help them.
Mm-mm. So the title again is Change How You Eat to Change How You Drink.
It's How to Eat to Change How You Drink. A
Okay.
long title.
I love it. Well, it's not
Thank you.
quite as long as mine.
What's
Mine
yours?
mine is, where is it? It's Eat, a guide to radiant recovery using food and amino acids to reduce craving, to repair the addicted brain and reduce cravings.
That's pretty good, though. And sometimes
Well,
we
it
can't go
it
without some of
says
the
it.
words. It's important. Yeah.
We do have to say it.
Hmm.
I start with eat. Well, okay, yeah, but eat why? And
Yeah.
so, okay, here's why. And you're saying, change how you eat to change how you drink, more or
Hmm.
less.
Hmm.
So, what's one big theme in your book that you would like people to know about? Why should they buy your book? I think they should
Well,
buy your book, by the way, Brooke, but
thank you, Christina. I think if you're interested in learning more about this topic and the way that alcohol, not only eating to change how you drink, but a big focus of mine in the book, Christina, is sharing more about how alcohol affects the gut and how it affects the hormones and how it affects our blood sugar. And
mm-mm,
not just because, when we're in recovery, we need to eat to manage those things, but also to understand that when we drink, it has an influence on all of these areas. And I
right.
think that's another widely overlooked component of it all.
It is. It is. And people forget about that. And I actually really like your blog, which I get however often you write it, about how you ask people to kind of connect the dots
Mhm.
between how their drinking behavior impacts their gut, impacts their mood, impacts their sleep,
Mhm.
impacts everything about them, because it
Mhm.
does.
Mhm. Well, I know for a long time I was drinking and I couldn't put those dots together for whatever reason.
Mhm.
Maybe it was the alcohol, maybe it was, something else, but I
That
really want people to have that experience or that awareness too.
right, right. Very, very important. So what type of practice do you have? I know you have an online community.
Right now, I don't have an open online community. I work individually with clients and also offer online courses and programs for people
Mm,
to self educate on these topics. So, everything from supporting or using food to change your alcohol use behaviors and to heal from alcohol, but also one of the newer things I'm doing is more on the nervous system regulation front
oh,
and
nice.
really learning how to eat to support the same pathways that make us want to drink or want
Yeah,
to smoke or want to overeat. Because whether or not someone's choice is alcohol or it's something else, that it's still part of the same biochemistry that is
it is.
creating that
It's the same
dysregulation.
process going on in the body. Right.
Totally, totally. And I think that understanding that and really just with the interest that people are taking in the nervous system now, it's really
Hmm.
interesting to be able to expand nutrition into that too.
Hmm. Well, cool. I'm really glad to hear that. And it's been lovely having this conversation with you.
Yes, thank you, Christina. It's great to meet you finally. And I love that we have so much in common. So we're going to have to collab more, I think.
I think we are. Absolutely. Um, so please, it will be in the show notes, but please let people know how they can reach you.
Sure. So you can learn more about me at brookscheller.com. I'm on Instagram at Dr. Brooke Scheller. And as Christina mentioned, I also have a blog on Substack. That's drbrookscheller.substack.com.
Wonderful. Well, everyone, thank you so much for joining us with this rather amazing conversation. If you liked it, please push the like button and the subscribe button and share it with your clients, with your colleagues, with your neighbors, with your family members. See you next time. Thank you for tuning in to Power Up Recovery with Nutrition. I'm Christina Veselak, your host, and I hope today's episode has inspired and equipped you with new insights and tools to support your recovery journey or practice. If you enjoyed this episode, please subscribe, leave a review, and share it with others who could benefit from the knowledge shared here. Stay connected with us for more episodes filled with practical advice, expert wisdom, and inspiring recovery stories. Remember, nutrition is a powerful tool in mental health and relapse prevention. Power up your recovery today. I'm Christina Veselak, and I'll see you next time.